nation's healthcare system is among the best in Southeast Asia, together with neighboring countries such as Singapore, Malaysia, and Thailand. The capital, Jakarta, does have many of the country's best equipped private and public facilities. In January 2014, the Indonesian government launched Jaminan Kesehatan Nasional Universal Healthcare in Indonesia. This scheme is the world's largest insurance system today that covers the entire population. One of the most important healthcare programs in Indonesia is the mother and child care. The mother and child care remains an important point of attention due to high infant and mother mortality rates. What effect does the JKN scheme have on mother and child care in Indonesia? And is there a difference in healthcare and healthcare utilization between rural and urban areas? To investigate this, we traveled to Jakarta and West Timor. West Timor continues to be one of the world's poorest islands. West Timor is part of the East Nusa Tenggara province in Indonesia. The capital, as well as its main port, is Kupang. There were approximately 1.8 million inhabitants. West Timor is a poor area. It has an average unemployment rate of 2.39%. In addition, 30% of the population live below the poverty line.
Okay, let me introduce myself. My name is Helda Sarishanturi. I'm a medical doctor here. I'm worked for 2 years here. I'm come from North Sumatra, Medan. For mother and child, we have a program such as seven-day center here. We have waiting house here down there. So this program is very helpful for mother because we can continue control mother and child. Can deliver normally, family can stay there. So because people here, if mother deliver baby, whole family to come to visit here. So we prepare one room complete in waiting house. So another program is ambulance to village. So if a mother deliver in night or in the morning, we can take them to the puskesmas here. Overall, they don't have insurance. We give the facility for free.
Okay.
Free.
Everything.
Because the government back up all the payment, so no free.
Okay.
Free for the facilities.
Okay.
Doctor only me.
Okay.
We have 25 midwife and 15 nurses, so it's enough for third generation healers. Find mother for first time, so they call us and tell us if one mother's new in their village. If you know from traditional healers, if one new pregnant, we have midwife in the village. We have 9 villages which have midwives. So midwives meet the traditional healers and tell us. So the communication like that. Culture here is very defect the mother and child for pregnant. Of course, especially for delivery. So the culture is here. I say in bahasa mama mantu, bapa mantu, satu keluarga, in whole family. With their cultures, that depends on the deliverer. And It's very difficult to break down the culture because they are the culture. So depends us walk come into their cultures and take there to the normal pathway. So it is a very difficult work. That's about the culture. Take here. Take the line. I can see the.
Is it a boy or a girl? I don't know actually. A girl.
Girl.
Okay, girl. Cute. And what's her name?
Culture here, turn 30 days, we can have the name.
Oh, not yet.
Yeah.
Just when she's 30 days old.
The
you
mother
will give
and
her-
father family come take this baby to church. So
Oh, yeah.
they have
Then-
the name.
Okay.
This case, we have to.
She doesn't like it. She's like, no, doctor.
We also see the color of skin, pale, red. It's the abnormality of the baby. We can know every day. So I visit.
You look every day?
Yes, I visit the baby and the mother every day. So if I see the abnormal situation, I take to the hospital. Timor baby, like this. Okay.
Our next stop is Jakarta, a city that hosts a population of almost 10 million people. It is to be expected that this population will even rise further. Jakarta is the capital and the largest city of Indonesia. It is located on the northwest coast of the world's most populous island, Java. It is the center of economics, culture, and politics of Indonesia. Jakarta attracts people from across Indonesia, often in search of employment.
Hi, my name is Bella. I'm a resident, OBGYN resident in Cipto Mangunkusumo Hospital, and currently I'm in my final year during the residency, my 4th year. So we have several programs here from the Ministry of Health, actually from Indonesia, and there are several programs such as we have 1,000 days of life program, which was started since the mother is getting pregnant, calculate about 9 months to 10 months, 40 weeks, and then also for the first 2 years of the baby's life. And during the pregnancy, the mother will receive the free antenatal care in the primary health care or puskesmas, or we call it puskesmas. And then for the baby itself, for the first 2 years, the baby will receive the free vaccination and health facilities as well. And also we have the book. We have the antenatal care book, which inside of the book there are the antenatal care follow-up, or the notes or the documentation during the mother's pregnancy. And inside the books we also have illustrator, so and using a very simple language. So we hope that the mother in every level of education will understand about the pregnancy itself. And we also have the contraception after post delivery. So our goal is that every woman who give birth in the facility, the healthcare, in the health facility, they have to receive the contraception right away. It will decrease the unmet need number. The unmet need is the condition where husband or wife where they cannot reach the health facility, though they want to use or want to have the contraception. So that's also our program. I think that is the newest. So we have this kind of maybe in not only in Jakarta but also in Indonesia. We have that we call it as posyandu. So the highest level of facility care is hospital, and Cipto is the national referral, and we have several hospital, and in one area there must be one puskesmas or primary health care, and the puskesmas will sometimes the midwife or the doctors will have several we call it ibu kader, or so ibu kader is like a regular housewife which is very concerned about health, and the doctors or the midwife in each puskesmas will teach them about, and we will educate them to be kind of like the health motivator for the area. When we in some district or some area, if it's easier for people to trust someone they knew it like in their daily life compared to maybe the doctors. So therefore the kader or the health motivator will help the primary health care to follow up for the babies and for the mother itself to posyandu. So every week or every 2 weeks they will have posyandu. So the puskesmas, the healthcare, the caregiver will go to the a smaller district to have pregnancy, and also the watching the child growth, measuring their height, measuring their weight, and giving their vaccination also. So that is how we reach the smaller area, or more specific specific district. So we come to the people if they to ensure that they receive health care as well if they cannot come to the puskesmas. I think yes, because Indonesia is archipelago. We have a lot of islands and yeah, very wide geographic. That is our main. Not I don't see it as a problem actually. Maybe more like yeah, our gift actually. So because of that geographic, we have like more than 500 tribes, but it's more to but it is the challenge. So because each tribe they not all of them are open to the outside to the to the metropolitan or the education or the modern access. Some of them are living in the mountain, in the forest. So yeah, maybe the access will be difficult for them, for the tribes that live in a very remote area. Oh yeah, sure. We also have various religions, and therefore each type of person, yeah, like each religions, each tribe will be like will be have like different approach for the healthcare, and still they will believe sometimes they are believe in the in the citizen or like in the normal people rather than doctor or nurse, because we are considered as a stranger. So that's why sometimes if we want to come to the like a remote area, or like we know that this area is very close, or maybe we also have the difficulty for their language, yeah, we will ask for help from the local people. The local people sometimes most of them, they are already open to the health and care about health. Hospital, we don't work with traditional healers, but in some area in some remote area we work with traditional healers, but the traditional healers more to like the health motivator for the local people there. We will try to give the traditional healers like understanding. So yeah, we hope that they can help us to gather the people. Okay, so regarding the insurance, Indonesia has several health insurance in the past 10 years, I guess. At first we call it as jam persal, that is jaminan persalinan. So anyone can give birth in any health facility just bring their ID, their national ID. Maybe it was about 2009, 2010, I guess. And yeah, at that time so many women are giving birth because it's very easy for them to access the health facility. But where's the weakness of that insurance? Now we have I think maybe we call it as national insurance or BPJS. It's not only for the mother and child health, but also for the any health problems. We call it BPJS. In the BPJS itself, there are several types. For example, for the public servant, they have maybe another insurance, but the goal is just the same. But the abortus itself, there is legal. I mean, there's a kind of like legal policy regarding the abortus. One of it is that if it's threatened the mother's health, maybe physics or or the condition, for example, the mother's in a shock condition, then we can perform the abortion, but in a safe way. But if we are talking about the abortion for the unplanned pregnancy, we will have a counseling first, counseling regarding the abortion, and we will try to give them a deep explanation, of course with maybe the partner or the husband. But if they are still want to do the abortion, then maybe we will refer it to other colleague to perform the safe abortion or anything. So we cannot do it anywhere. Maybe that is our that is our homework, because all I know is that we don't get sex education material for the school age children. So yeah, they receive the sex education maybe from the doctor, or if someone they knows about the sex education and contraception itself. But this material itself, it's not national material in every school yet. Maybe that is our homework. Well, if we are talking about the mother and child care, the best way is to increase the prevention program. I think it will be much more effective and efficient to increase the success rate of the prevention rather than the curative program. Yeah, so since I think the important point is when a mother or a woman is planning a pregnancy. So yeah, the preconception preparation is very important. If someone is, maybe we know that perhaps, for example, she's anemia or she's got malnutrition, it's better for her not to get pregnant first. First we have to fix her problem. Then if she already get a good health condition, then she can have a better pregnancy condition compared to if she got that condition and she got pregnant. I think the most important is preconception before a mother gave birth. Then I think the next thing, it will be much better.
The overall healthcare service for mother and child in Indonesia is improving. However, the gap between rural and urban areas remain large due to differences in provided care, coverage, culture, and the geographic character of Indonesia. Regardless of health insurance for the poor, access remained an important issue for Indonesians in rural areas. Healthcare workers try to improve access by working with local traditional healers, regular housewives in posyandus, and important local members. They also try to improve access by visiting remote areas.